So as you know, I like to show pictures, but we want to bring it down to its simplest level. So when we're thinking of DNA, I want you to think of DNA in your body, in your cells, just like a cookbook. And in this cookbook, you have recipes. So in the case of DNA, instead of recipes, you have genes. Now, these recipes tell you what the combination of, whether it's flour or sugar or eggs and milk combination that you need. The amino acids are what help you construct the final output. In this case, I like peach cobbler, so we're making a peach cobbler, even though I have some cupcakes up here. But in this case, the whole concept here is this. Let's go back to the fact that in DNA, you may have mutations. So you think about these mutations the way you think about typos in the document that you've created or someone's created. And also think about correcting these typos by having a spell check mechanism. In this case, the cells have its own unique mechanism of correcting. Next, also, when we start talking about genetics, I want to bring everybody back and we talk about the chromosomes. And we have 23 chromosomes. And the chromosomes are made up of DNA. Now, these long strands of DNA. And then as you go down a little further, the DNA is made up of genes. So remember, when we think about genetics, this is scientific study of genes and heredity and how certain qualities or traits are passed on from your parents to children as a result of changes in the DNA sequence. So now, and genes are just a segment of DNA that contains the instructions. Like I said before, it's like that recipe for building one or more molecules that help your body work. Now, some words that you'll hear throughout the presentation with me and with Justin, and germline mutation. And what we want people to understand, when you hear this germline, I want you to think of genes and lineage. Now, their germline mutations are gene changes in your body, and they normally take place in those cells, the reproductive cells of the body, the egg and the sperm, and they're incorporated into the DNA of all the cells of the body. So germline mutations are found in all the cells of the body, and they're passed on from the parent to the children. Now, germline mutation testing can help assess one's risk for prostate cancer. Somatic mutation, on the other hand, is a gene change which occurs in a single cell and only affects the new cells that are created from that mutated cell. Remember, somatic cells do not pass on this mutation to the children. And somatic assessment or somatic testing examines the genes in the prostate cancer specimen to help determine the line of treatment. Now, you'll hear about PARP proteins, and these are proteins that are normally found in the cancerous cell and are responsible for DNA damage repair. But what happens if you have a molecule or a therapy that interferes with damaged DNA repair? There's a class of drugs called PARP inhibitors that prevent these PARP proteins from repairing the DNA damage. Now, this weakens the cancer cell, making it more susceptible to chemotherapy or other treatment options. All of this boils down to one thing. We're moving to an era of personalized cancer care. And in doing so, and knowing this is why it's important for you to understand and know your genetic information, because this will better help you manage your prostate cancer. Another way to look at this, again, germline mutations, genes, lines, lineage. So that means that this is information that's inherited and passed on to your children. Now, 10% of prostate cancer is inherited. Genetic tests assess one's risk for prostate cancer. Somatic mutation, on the other hand, the DNA mutates, but it's not passed to the children. 90% of prostate cancer is from somatic mutation. So genomic testing examines genes and helps predict the prostate cancer behavior. Now, what are the benefits? There are numerous advantages of if you know what genetic mutation and how it links to prostate cancer. So from an individual perspective, you can individually screen. So now you may wish to undergo prostate cancer screening, and it may start at an early age, even if you have no family history. But if you're an African American, normally we're at high risk. So one would suspect that we may want to think about individual screening because we're high risk. Now, but you think about it, just because you may have the gene, do you think your family members could have it? Because remember, certain genes are transferred over, or mutations are transferred over from family members, from parent to child. So even though you may have a BRCA mutation, but your female members of your family may have the same mutation, but that would put them at risk for breast cancer or ovarian cancer. So this is why it's important not to just think about the impact on yourself, but also on family members. Genetic testing can help predict how aggressive prostate cancer might behave and how likely it is to advance or metastasize. And again, we're moving into this precision medicine era where you can individualize or customize your treatment therapies. Term inherited genetics now significantly increases the risk of prostate cancer and may be associated with aggressive disease. So I say it again. These risks, genetic mutations, may be associated with aggressive disease and poor outcomes. And these hereditary information can have implications for other men in your family as well as other family members. Germline genetic testing. Again, I repeat it. Germline, you're thinking genes, you're thinking of something that's passed on to your children and from a parent. And it is now strongly recommended that patients with advanced metastatic prostate cancer, particularly given the impact on targeted therapies, or clinical trial options, should think about genetic testing. Now, all patients with metastatic or high risk or very high risk localized disease should be tested for genes. Now, there are in this case, about 8 particular genes. And I want to highlight BRCA1 and BRCA2. Now, you may have heard these names, but just for your understanding, BRCA, BR is breast, and CA stands for cancer. So it's cancer gene 1, breast cancer gene 1, and breast cancer gene 2. That's what we'll focus on today. Now, genetic counselors may suggest testing these additional genes. And in this case, this is HOXB13, which is very interesting, and we may talk about it later. But it's commonly found in people in the earlier stage of disease. So for Black men who have a high incidence of contracting or developing prostate cancer in their 40s, it may be important for this gene to be assessed. Now, there's something that your clinicians or your genetic counselor will talk about is this risk, this BRCA1, BRCA2 risk. So it's called a familial high risk assessment and to determine whether or not you should have BRCA testing. So men with metastatic prostate cancer, men with a Gleason score greater than 7, who have at least one close relative with ovarian, pancreas, or metastatic prostate cancer or breast cancer at or less the age of 50. Now, you see what I'm saying here is you don't necessarily have to have someone in your family who has prostate cancer. You may have an aunt or a sister who has ovarian. You may have somebody who has pancreatic cancer or breast cancer. So it's very important. The other, 2 or more close relatives with breast cancer or prostate cancer at any age. an Ashkenazi Jewish ancestry. And important, prostate cancer screening recommendations include starting at age 40 for BRCA1 or BRCA2 carriers. Now, we've talked about this inherited component. Now let's talk about testing, somatic testing for prostate cancer. Just to hear it again, somatic mutations are not inherited. Now, what's interesting, they can change over time. And that's why it's very important for, even though you've been tested one time, a doctor, your healthcare provider, may want to test it again to see if there's been a change in the overall genetic makeup of that cancer. Now, somatic testing help determine what your treatment options are, because now we have treatment options. PARP inhibitors, I mentioned earlier, immunotherapies are been associated with gene changes. And we have clinical trials like Amplitude that have determined your eligibility to proceed further in the clinical trial. Now, you may hear, or you may have already heard, something called NGS. There's next generation sequencing. This next generation sequencing is a much more detailed sequencing. It allows you to look for specific gene pathways, whether it's antigen receptor amplification or any other pathways that may be associated with genes. Now, what about the source? When we start talking about somatic testing of prostate cancer, the source is different. Now, genetic testing, you can get it from the blood, you can get it from the sputum, and you can also get it from the urine. Now, the source for somatic testing is they target primarily the tumor resection. So they may get an old tumor specimen and look, or they have to biopsy your cancer again to get that information. Now, what's interesting here is they also can look for something called circulating tumor DNA. And that's DNA that's specifically from that tumor that's found in the blood. I've mentioned before, once you have this genetic information, now you can use this to better manage your cancer. Now, on the right side, left side here, across the top, I'm going to cover like genes, those that have an increased risk, other cancers that are associated with these genes, and that there are combination therapies like PARP inhibitors plus a chemotherapy, immunotherapy, and also preventive screening. So these 8 genes, if you follow the check marks, but again, we're focusing on these BRCA1 and BRCA2, but these other 4 genes here can play a role in your management. But the first 2 are important. And I just want to highlight again, you may have BRCA1. This increases your risk, but it could increase the risk of someone in your family to have breast, ovarian, or pancreatic. So again, you can use genetic testing to help not only manage the treatment that's available. Now, do you want PARP versus a chemotherapy, PARP inhibitor versus chemotherapy, or immunotherapy, immuno-oncology based therapies? So that's kind of the take-home message there. You can screen, be preventive and predictive, or you can better manage your treatment. So the question is, why should Black men get genetically tested? That's your big question. I mean, we know Black men are known to have an increased risk of being diagnosed and dying from prostate cancer. Now, Black men are more likely than Caucasian American or Asian American counterparts to have a broad range of genetic changes that increase the risk of developing prostate cancer. Genetic testing is beneficial for identifying Black men with metastatic castration-resistant prostate cancer who could benefit from these new therapies. And remember, we're talking about these mutations, BRCA1, BRCA2. Now we can determine who's eligible to use these, because the FDA in 2020 approved rucaparib and olaparib, these 2 therapies for the treatment of metastatic castration-resistant prostate cancer. Now, there exists, and this is what a lot of people don't understand, and this is why Finn is pushing this. We recognize that there's a disparity that exists when it comes to Black men and prostate cancer. And this is a large racial disparity. What's interesting is this, and this is what we want to emphasize. Prostate cancer, one, is highly inheritable disease. Now, this is a large disparity that exists across racial and ethnic groups. African American men are at increased risk of being diagnosed and dying from prostate cancer. Prostate cancer incidence varies across racial groups and is approximately 75% higher in African American men, but 45% lower in African and Asian American men when you compare that to Caucasian men or non-Hispanic white men. Very important. So now you're starting to see this disparity, this difference genetically and how the disease behaves. African American men are more likely than their Caucasian or Asian counterparts to have a range of genetic changes that increases their risk for developing prostate cancer. Now, we know that age, family history of prostate cancer, and germline mutations are the most established risk factors for prostate cancer. But did you know over 50%, 57% of this variability in prostate cancer risk is estimated to be due to genetic factors, these genetic mutations, these genetic changes. So we hypothesize, like others, that genetic factors may contribute to this disparity in African American men when it comes to prostate cancer. You may ask, well, then why should Black men participate in clinical trials? And this is to point out the human genome. We sequenced all the genes of the body. It finished in 2003. And from 2003 to 2022, almost 19 years, we have been able to identify these cancer risk locations. But the problem is a lot of the research have been done on people of European ancestry, about greater than 80%. And then next in line for these risk locations in the body are those people of Asian ancestry, East Asian ancestry. And then there's a collection of multi-ethnic data points that exist. But African American and Latin Americans only have about 1% of this information from them. And this is just a drive point, is that this is why Black men need to participate in clinical trial research. So let us begin to stop closing this gap. So our takeaway, germline mutations are gene changes found in every cell in your body and are passed on from parent to child. Germline, passed on from parent to child. Somatic mutation are gene changes which are restricted to a single cell and are not passed on to their children. PARP inhibitors are a class of drugs that prevent PARP proteins from repairing the DNA damage and weakens the cancer cell, making it more susceptible to chemotherapy, immunotherapy, and other treatment options. Men with metastatic castration-resistant prostate cancer who have BRCA1 or BRCA2 mutations may be eligible for treatment with PARP inhibitors. And just remember, I'm not going to give you all the genes, but there are other mutated genes that you need to be aware of that may make you eligible for some of these new therapies. And lastly, Black men are more likely than Caucasian or their Asian counterparts to have a range of genetic changes that increase their risk of developing prostate cancer.